Hi, my name is Richard Isaacson. I'm director of the Alzheimer's Prevention Clinic at Weill Cornell Medicine and New York Presbyterian. Today, we're going to be talking about endpoints in Alzheimer's disease clinical trials. Let's talk about the Functional Activities Questionnaire, or the FAQ. The FAQ is an observer-reported outcome, meaning someone has to be interviewed about the patient with Alzheimer's or the person with dementia's cognitive complaints and their ability to function in everyday life. This outcome provides both a clinical and a functional measure of IADLs, or instrumental activities of daily living. And it's assessed, again, by an informant. It has to be a caregiver that spends a fair amount of time with the patient, or a family member that knows the patient well, or even a friend. The categories are several. Again, they're related to IADLs, including: can you remember appointments? Can you write checks and pay your bills? Can you shop? Can you keep track of current events? Can you travel around the neighborhood? Can you balance meal planning? And can you, attend other events? So these are all things that are very functional in terms of a person's life, and that's why it's called the Functional Activities Questionnaire. The performance in each category is ranged on a scale of 0 to 3. 0 is normal. 1 has some difficulty, but the person does it by themselves. 2 requires assistance, and 3 means that they're dependent for that specific activity. Score ranges, they're cumulative, are from 0 to 30. Higher scores on each category indicates greater functional impairment, and lower scores means the person is much more close to normal. When it comes to advantages, the good news about this outcome measure, and I think it's very worthwhile, is that it can predict progression of MCI, mild cognitive impairment, to Alzheimer's disease dementia. It also shows kind of patients in terms of a very specific set of standard questions, rather than general question of, oh, how are you doing? Or how is your loved one doing? Or how are they doing today? This is a much more kind of regimented structure. It's also a very highly translational measure, meaning the ADLs, or activities of daily living, or IADLs, are oftentimes interpreted by not just me as a clinician, but also by a caregiver or a loved one, to be a meaningful metric, or more of a pragmatic assessment of clinical change. However, the limitations also a few. For example, the questionnaire can be incomplete if the patient has not performed an activity, and there's definitely some subjectivity that's involved, as well as some bias, because again, oftentimes the family members or caregivers may be rooting for the person to do better, so they score them in a different way. Or other times, when a caregiver or a loved one has burnout, they may score a patient differently than they may have if they were kind of feeling better and were well socially supported.